So you've hurt yourself. Now what? Is it hot or is it cold? What do you put on it? That is the million-dollar question. Hi, I'm Kelly from Body Health Mechanics. I am a registered massage therapist in Ontario, Canada. I am in my second year of holistic health coach, and I am also a Reiki master. The primary goal for this channel is to help you become your own mechanic. Please like the video and subscribe to the content so I can help others become their own mechanics as well. So in today's video, we're going to be discussing hot, cold, and contrast. Now, as massage therapists, we're taught from this book. If you are interested in this book, I will be leaving a link in the description box below for you to click on if you are interested. So in saying that, with physios and chiros, we're all taught probably from different books, and I'm not here to argue anybody's right or wrong. I am simply here to show you how to use all three of these different modalities. So first things first, what I was taught, what heat does. Starting with this. Heat, if you've injured yourself and you put heat on the area, let's say your arm, basically what that does is it attracts all the blood to the injury site. So all the blood comes up and trying to cleanse it out. If you've injured yourself and you put cold, what the cold does is it flushes it out. It does the opposite. It pushes the blood out of the injury site. Again, not necessarily debating what's better for these injuries, just what I was taught. Either bring it in or push it out. The contrast, however, is kind of like a Control-Alt-Delete. So it flush, clean, flush, clean, flush, clean. It just, oh my God, what am I doing? And let's just clean everything out and just figure out kind of some sort of reset button. All right, so hot. This is going to be our hot water bottle because it's red and it's easy to see. This is going to be our magic bag. It's going to be cool because it is freezing. I think it was in the freezer. So essentially what you're going to do is you can put it again with whatever temperature you're comfortable with, whatever your body is okay with. We're listening to our bodies. And then you're going to basically place it on wherever you've hurt yourself. Let's do this because it's easier to see. You're going to put it there for like 5-10 minutes. You don't need to put it on for very long because eventually the muscle gets used to it and it's like, whatever, I've got it, I know what you're trying to do. And it doesn't respond anymore. So if you give it a break for 5-10 minutes or even 20 minutes and then come back and do the same thing again for heat, that's fine. You don't need to leave it on for hours on end because like I said, the muscle just gets used to it. And then it just doesn't respond. The same thing with cold or cool, or freezing in this case. But if you have cool, you're putting it on this particular spot for just a little bit. If you follow the CBAN rules, it's cold, aching, burning, numb. If you have it really cold, numb is where you want to stop because that means the nerve is like, I'm done. So you're putting the cool or cold, whatever, on whatever you're doing. It's only for a couple of minutes. It doesn't need to be for very long as well. And you take a break because again, it's the same thing. It just it doesn't deaden the nerves, but it just kind of like has a analgesic effect where it basically takes the pain away, which is nice, but it's not necessarily where you want to be totally. So with contrast, it's a little bit of each. So either warm or cool or hot, cold, whichever one, like I said, your body is okay with. So you figure that one out. And what you're going to do on this, again, for your arm, because it's, again, you can see this, you're putting hot or warm on this spot for like a minute. And then you're going to switch and do cool for like a minute. However, if your body, especially with the cool, is like, it's really cold, you don't have to do a minute. You can go like 20-30 seconds. Enough to make a difference. It'll be a huge difference, and you just keep going back and forth between the warm and the cool. It doesn't have to be exactly a minute. You can time it if you totally want to, but your body will also tell you that you don't even feel the warm anymore. You don't feel the cold. It's just I know you're there kind of thing. Keep going back and forth, and like I said, that's kind of like a Control-Alt-Delete where it just reboots the system. So a side note about the hot and cold and contrast for that matter, there's a lot of people who do not like extreme temperatures, myself included. I do not like really hot or I do not like really cold. It's somewhere in the middle. If you are menopausal, if you are fibromyalgia or MS, there's lots of reasons why you would not like extreme hot or cold, and that's okay. As long as you can feel a difference, either warm or cool, from what you have in your hand to what your body temperature is, it will have an effect. So a few tips that we were taught and a few things I've learned along the way. If you are having a hot flash, you have a towel that is obviously not dripping, but just cool, in some cool water, wring it out and put it around your neck. The other thing you can do is if you have a headache or migraine, is you put the heat either in a towel or in a magic bag or whatever at the bottom of your neck here, and then put the cool, and this is freezing, let me tell you, at the top of your head like this. It forces the cool down and the heat attracts the blood down, so it gets away from where it's not supposed to be. And the last thing is if you were on your feet in the very beginning, and your feet are starting to get sore and swollen and it's all bloated, our first instinct is to put your feet in heat. Try putting them in cool. The cool, again, it forces the blood back out, and it actually feels really good. So in summary, for this video, we are, again, not arguing with anybody's theory. I'm just trying to show you how to use these different approaches, the hot and the cold and the contrast. So again, with the hot or the warm, make sure it's only for like 5-10 minutes, because again, the muscle just starts responding like a teenager. It just doesn't. And then the cold, again, please remember CBAN. Cold, burning, aching, numb. Cold, you feel the cold. It starts to burn slightly with the cold. Aching is when you want to take it off. When it starts to ache, take it off before it gets numb. That way you're not numbing anything and those nerves are still intact when you're trying to help it. Thank you for watching. See you in the next video.